And you're watching Live Impact News on WCNC Plus. I'm Jane Monreal. So today we are wearing red, National Wear Red Day, and we're wearing it because it supports the American Heart Association's Go Red for Women movement. Cardiovascular disease is the leading cause of death in the U.S., accounting for approximately 1 in 5 deaths a year. So joining us right now is Dr. Thomas Camber. He's a cardiologist with Novant Health to talk about what we can do to reduce our risk. Good afternoon, doctor.
Good afternoon. Thank you for having me on today.
Well, thank you for joining us because it's such an important topic any time of year, but certainly if we can give it some extra awareness during February, let's do so. So let's talk about heart disease and that it affects older men, but statistics, they tell a different story, right?
They do. Actually, women are at risk for this almost just as much as older men, especially after menopause. And it's not generally recognized quite as much. That's why it's so important to talk about and why the American Heart Association has been making this more public knowledge through campaigns like this. So it's very important to understand that.
Why after menopause?
There's hormonal fluctuations that put women at higher risk after menopause. And the symptoms can in general be a little bit different for women. Less classic. We typically think about chest pressure, shortness of breath, pain radiating to the arm and jaw. For women, these can present differently, especially as we get a little bit older. Sometimes just fatigue, nausea, indigestion, even back pain sometimes. It can be slightly different for women, so it's important to pay attention to these nuances for things off, especially for women as we get a little bit older.
Now, I read that 80% of premature heart disease and strokes are preventable. 80%, that's an incredible statistic. What are some of the things that we can do then that we can prevent such a terrible outcome?
Excellent question. There's a lot of risk factors that we can modify to improve that, decrease our risk. Blood pressure, high cholesterol, diabetes, making sure we're controlling that. So making sure we're seeing our primary care physicians and monitoring these things, evaluating for them and treating them if they're issues. Routine exercise, at least 150 minutes a week is what's typically recommended if we can do it, but any amount is beneficial, really. And then trying to stay away from habits that may also increase risk, like smoking, tobacco products, excessive alcohol, things like that.
All right, so some of the warning signs, you mentioned that women do experience it differently. What should women never ignore anytime, menopause, pre or post?
The way that it can present so atypically, new moderate to severe symptoms should not be ignored. We do classically think of the chest pressure going to the jaw, things like that. But anything with activity in particular, if you suddenly can't do the activity you used to be able to do, you're a little bit more short of breath, you're a little bit more fatigued, you're getting lightheaded. It doesn't even have to be severe, maybe just a mild change, but it's new for you and there's not an explanation for that. That can be a sign of underlying cardiovascular disease that deserves evaluation.
For someone watching right now and they want to go ahead and start taking charge of their heart health, what's the first step they should take?
The first step they should take is talk to their healthcare provider about it. Do some of your own research, but combine that with seeing your healthcare provider if that's your primary care, as it is for most people. Just having that conversation, understanding with their guidance where the risk factors are, what we can modify, what kind of screening tools are available to make sure that we understand what all the risks are in this individual person, and then mitigate those or minimize those as much as possible. And for a fair amount of people, that may end up going on to see a cardiologist to further help manage anything that's been identified.
And because you're a cardiologist, you've seen what happens when there's a cardiac emergency. How important is it for just everyday people who may not be in that immediate or in-your-face trouble zone, but how important is it for all of us to know CPR, what to do if we see one of our loved ones go through a situation, an episode?
Yeah, it's extremely helpful. So, cardiac arrest or sudden death is typically due to an abnormal heart rhythm called ventricular fibrillation or ventricular tachycardia, and ends up with the heart stopping to pump. And the gold standard for helping that person is immediate CPR, and minutes matter. Within 3 minutes plus, you start to have severe damage to the brain, to the heart, other things like that. So if someone has a cardiac arrest, if we can start CPR immediately, then they can have a decent chance of surviving that and surviving that intact with good mentation without having brain damage, things like that. So it's actually imperative. It turns out 90% of people do not survive cardiac arrest because a lot of times CPR, things like that, are not immediately available. But if you know how to do that, and you're with a family member or someone else in the community, you can really help a lot. You can save a life, and almost anyone, I think, can learn how to do it.
Yeah, absolutely. Anything else we should know, especially when it comes to the factors that are unique to women on this National Wear Red Day?
Just pay attention to your bodies. As the biggest thing is that you are at risk. It's not just older men. You do have some risk too. So and the symptoms can be unique. So pay attention. If it's new, it's not normal. Don't brush it off. Talk to your health care provider about it, and make sure we're investigating these things so we don't miss anything, and we can mitigate the risk as much as possible.
Dr. Camber from Novant Health, thank you so much for the conversation. Good information for all of those out there. Thank you.
Thank you for having me. Have a great day.
You too.